Officials with the U.S. Department of Justice and the state of Maine say they have entered into a settlement that requires the state to increase community-based behavioral health services for children. The settlement stems from a lawsuit the Justice Department filed earlier this year that said many unnecessary segregates children when behavioral health issue disabilities in institutions. Investigators said at the time that the state's actions violated the Americans with Disabilities Act and the children's right not to be confined away from their families. The Justice Department says the settlement requires Maine to make changes that help children remain with families or foster families and avoid emergency department stays and institutions. Governor Janet Mills says these behavioral health challenges predate her administration, and she's proud of the work being done by Maine DHHS to improve these programs.
We expect to reduce the burden on hospitals, and one of the issues is providers not having enough staff, payments of providers, things like that. Many details are addressed in this settlement agreement that should relieve the burden on hospital emergency rooms and on providers of other sorts and on families.
In the state's last budget, Mills and the legislature allocated $2.2 million for behavioral health services. Mills is expected to unveil her next budget plan in early 2025.